Good afternoon, ladies and gentlemen, and welcome to our Macon County Board of Education's reopening plan release for fall 2020-2021. As you know, we were certainly hoping that we would be able to open the doors this fall to each of our schools for our boys and girls to be in person for teaching and learning. However, as the days have unfolded and we have looked at the COVID data specifically for Macon County, our advisory team has come to the conclusion that it is better for us here in Macon County to open our schools virtually. We will reopen Macon County schools for fall 2020-2021 on August 6, 2020, virtually. And with that, ladies and gentlemen, we present to you our fall reopening plan today. To each of our parents, you should have received a link via your text message from Schoolcast, sharing the link with you to pull the plan from our website. If you did not receive this link for some reason, you may go to www.maconk12.org, which is our school district's website. Click on the link under the reopening plan and give it sufficient time to open. There you may view the plan, print it, download it, or save it for your review. Our plan is 60 pages in length, so it is sizable, but it needed to be comprehensive for all of us to understand and be on the same page. As well, we will not be able to answer all of your questions today, but in the plan, all of the emails of the various persons in the district, as well as the school principals, are listed, and you are welcome to send your questions to us. Also, on next Friday, we will send you information where we will have a call-in line for our parents, where you can call in after having reviewed the plan for a week and ask any questions that you would like to us. And we encourage each of you to do so. I would first like to thank my central office and school-based district leadership team who have been here with us on site for most of the closure period that we had in the spring, as well as the summer period, with the exception of a 14-day span when we closed down. So yes, we have frontline workers in our school system as well. I would like to give an exemplary shout out to our school nutrition program director and staff. Our cooks have been here basically every day this full summer, putting themselves on the line to get meals out to our students and families, as well as our bus drivers who drove meals around the county, the volunteers and workers who helped them, our janitors and our maintenance staff who have been on site handling our cleaning needs. Ladies and gentlemen, it does take a team, and we thank God for everyone who is a part of Team Macon. With that being said, I would like to go a little bit further and thank our advisory team that we pulled together to put this plan together. And if you will, I would like to share the names of those individuals. And they are LaWanda Gray, lead nurse; Robert Stratton, maintenance director; Frank H. Lee, Macon County Emergency Management Director; Andre Brunson, sheriff; Albert Nelson, student services coordinator; Natalie Young, chief school financial officer; Emma James, school nutrition director; Tracy Jackson, transportation supervisor; the illustrious Dr. Dina Maxwell Stafford, local physician, Alabama Department of Public Health Board; LaShondra Richardson, parent, Head Start administrator; Erica Muhammad, community leader; and Thomas C. Coley, UNISERV director, as well as Erica Muhammad, community leader. Of course, again, our district's leadership team, and our parents and students and staff who completed our end of the year survey. These are difficult roads ahead. And what I can tell you is that when we do, and if we do get the opportunity to reopen in person, school will look very different this year. which is why we have the plan. The plan is numbered, it is paginated so that you can see the various pages in the plan. And first, I would like to give you our assurances of what we hope to do. We hope to communicate well with you using all channels of communication. We hope to continuously gather input from you. We hope to be thoughtful and intentional in all planning and decision making. We will always look at our local data here in Macon County over any other data anywhere in the world when we make our decisions. Normal activities for this year may or may not occur, and we are talking about things like open house, homecoming, healthy Halloween. There is a possibility. We are not certain what may happen with sports. We will work to keep all information confidential, but we will work to trace and pinpoint cases so that we can help mitigate the spread. A virtual option for learning will be present all year long for those parents who have concerns about their students' health. We will prioritize critical academic standards, particularly in math, English, science, and social studies. And folks, we will make mistakes, lots of them, because we're in uncharted territory. But always charge them to our head and never to our heart. What we ask from you, we ask that if you have a situation or a positive case with your child or family, that you please let our lead nurse or me in the school system know. We ask that when we do move to in-person learning, that you keep your child home if he is sick and allow him to access school remotely. We ask that you adhere to all processes, including wearing a mask when you enter any Macon County Board of Education property or waiting in your car if that is the request. We ask that you keep the school supplied with a current home phone number, cell phone number, and email address. We realize that decisions made in the school calendar had to be made at the last minute, but please keep in mind that these are for the best and last minute changes may occur throughout the year. We ask parents that you work diligently to get the internet or Wi-Fi into your homes and allow us to assist you with that. Every child in Macon County must be connected. Communicate regularly with your child's teacher, and you will get a link following this press conference to choose the mode of learning you would like for your child once we're able to move back to in-person. You will still have the options of in-person, remote learning, or a mixture of both. Again, the first day of school is August 6, 2020, and that will be virtual. How long will we stay virtual? We will evaluate our virtual status after each 3-week period. So after the first 3 weeks, after 6 weeks, and after 9 weeks. It is very possible that we may be virtual the full 9 weeks depending on the data. We will keep you apprised of our situation. Our plan is based on a color-coded system. The Alabama Department of Public Health also has a color-coded dashboard that they are using. And we will partially rely on their dashboard as we determine our color levels of alert. The 4 colors are red, orange, yellow, and green. And as you can see, the name of our plan is Progressing to Green. We're trying our very best to get to a level of green. We have several considerations for you. And the considerations that we have to keep in mind as we try to reopen school in person include preparation of facilities, health services, transportation and attendance, meal services, technological services, instructional services for HIPPY, instructional services for pre-K, Instructional services for elementary, grades K through 6. Secondary instructional services, grades K through 12. Instructional services for career tech. Instructional services for electives. Instructional services for our special populations, special education, English language learners, homeless and foster care students. Instructional services for virtual school. Instructional services for after school. We also have to be cognizant of student services, federal program support, personnel services and needs, and financial services. These are all of the areas that go into school operations and planning that are considerations for us. As we said earlier, our plan is based on color levels of alert. And our color levels of alert are red, orange, yellow, and green. They may or may not coincide with the dashboard from the Alabama Department of Public Health, but we are partially relying on their dashboard. In your plan, parents, please thoroughly read what happens at the red level of alert. We are currently red on the Alabama Department of Public Health's dashboard for Macon County, and likely most of the surrounding counties, which means that the risk for COVID infection is very high, very high. When we're at the red level for the school system, which is on the right side of the document, we will operate in a virtual mode. We will operate in a virtual mode. At the orange level, the risk is moderately high, and we will operate in a staggered mode, meaning we will bring 4 grades of students into a school at a time. We will only use 2 schools during the orange level of alert. Those 2 schools will be Notasulga High School and Booker T. Washington High School. We will use 2 schools only during the orange level of alert. During the yellow level of alert, we will move to 4 days of instruction. Monday, Tuesday, Thursday, Friday. Wednesday will be a parent conference, restock, and other needs day during the middle of the week. And finally, in progressing, we hope that we can get to green as soon as possible, where we will be able to have 5 days of school instruction. But even at the green level, social distancing, masking, face shields, hand sanitizing will still be in play. So even when we have the most optimal conditions, as long as we're in pandemic mode, things will look and feel differently at school. Processes for COVID-19. We are working to reduce the spread. Parents, I'm on page 36 of the plan. And, I'm sorry, page 35 of the plan. Screening starts at home. Parents, we're asking you, even during the virtual mode when we're red, check your child's temperature and check your temperature. All COVID cases do not have a temperature affiliated with them. Some may be asymptomatic, but many do, at least half. So please make sure you check temperatures before sending kids out into public spaces, and we can reduce the spread. We will be asking you to do that same thing when students return to in-person school. When we move to in-person school, we will also have an app that each student will have on their iPad, cell phone, or device, and each staff member to answer questions that will determine if they are red or green and should proceed to school. On page 36, we are informing parents and staff that all who enter the building will either wear a mask and a face shield, or a mask with a face shield. So please make sure that we are aware that students and staff will be wearing face coverings. We will also use plexiglass and clear drapery throughout the school, hand sanitizing stations, water coolers rather than water fountains, notebook bags. The school district will supply school supplies, and school furnishings will be used as adjustable tables. We will clean and disinfect on a regular basis, and we will have set up a well and a sick clinic, much as is done in a pediatrician's office. We will have scheduled bathroom shifts, and we will do all of our staff training virtually. Reducing the spread on the next page, page 38, we will have stickers on the floors and signs on the walls to remind persons of the best behavior to help reduce the spread. And I want parents to understand that the 14-day quarantine is what we work for when we have a positive or an exposed situation. It does not mean a building is closed for 14 days. It means that we make sure that we trace to all of the persons who need to quarantine for 14 days. So the 14 days actually has little to do with the building. What we have to do with the building is to make sure we get it clean, we get it sanitized where the spread likely occurred or the contact likely occurred. And that can happen in as little as 4 hours or as many as 48 hours, depending on how much space we're talking about. But the 14 days relates to people and not buildings. If we have a student or a parent or a staff member or the staff member's spouse with a positive test for contact exposure, please contact our Student Health Services Department or my office so that we can begin to assist with that process. Parents, we also want to share with you our next section, which is academic protocols. And you can read in that section things for pre-K all the way through things for 12th grade on page 42. On page 43, you will see the teaching and learning in a COVID environment. We will be sending a daily schedule of teaching and learning. Our staff will be on site. Our staff will be on site, but they will not be taking visitors. They will be isolated in their offices and in their classrooms for the purpose of teaching and learning. So you will have to contact them and have parent conferences virtually. On these pages, under academic protocols, you can see the roles of each of our staff members, from bus drivers all the way to your district administrators. Our next section is section 6, and that section is schedules and protocol. Parents, please make sure you read this section very thoroughly. This again tells you about the daily schedule and how much time each child should spend with screen time depending on his or her age or grade level. All right. The next section is remote and digital learning. This is connected for learning. And in this particular section, we start to talk about what we have available for you. And what we have available for you will be iPads and devices that each parent may sign for and have for his child. We have enough for every student who needs one. We have enough for every student who needs one. The next thing, parents, we'd like to let you know is that we need every household again connected. I cannot say that enough. That was one of the barriers we had during the spring. We had a lot of households that were not connected for various reasons. Therefore, we have ordered 1,100 hotspots that we will deploy to the homes. These hotspots are $85 each, and the district is bearing that cost. We're asking the parents to bear the subscription plan, and it is remarkable. Unlimited data, and you can read that in the plan, and it connects up to 8 devices in the household, which means parents can connect to it, students can connect to it, and have the needed connectivity. We're working with 3 different service providers, so if we find that one service provider does not work in your area, then we will try until we find one that does or can. In the event that that is not possible, we are so happy that these hotspots are mobile. So parents, that may mean some commitment on your part. They may have to be in the car, or you may have to drive to a safe space where you personally consider safe, whether it's grandma's house or it's under the tree at one of the local businesses or establishments in a safe environment in the park. But the hot spots are mobile, and so you'll be able to take them until you can reach a place where you have a point of connectivity without needing to go inside of a building if that is your choice. All of these things are designed to make sure that we have connectivity. So devices and connection points are being established. As well, we have 38 school buses that will be outfitted with a dual SIM card cradle point system. And you may say, well, what does dual SIM card mean? It also means that same type of thing, that the bus internet connection will be able to toggle back and forth between the different service providers depending on what area of the county you're in. So if SIM card A doesn't work in your area, then that particular device will toggle to SIM card B in hopes of getting connectivity in the area. We plan to put the school buses in all of our apartment complexes throughout the county so that every apartment complex then becomes a giant hotspot here in Macon County. And every student and every family can have connectivity. That is our plan. There are 3 types of learning that you will be able to choose from, parents. And those 3 types of learning, again, are remote, where you can choose to stay virtual for the remainder of the pandemic. You may choose to be hybrid, where the students are at home the majority of the week learning with you, and you send them in on their assigned day of the week to get support from an in-person teacher. Or you may choose to have full in-person at whatever level of color alert we can offer that when we go back to in-person learning. We also have a 4th option that's a little bit different, and this option is referred to as our MC Virtual School. We actually have a separate entity that is a virtual school that has been established for the past 3 or so years under the Virtual School Act that was passed back in, I believe it was 2012 or 2013. And so some parents may want to stay virtual for the duration of their students' matriculation in school, which means that you want them to actually graduate having been in the MC Virtual School. That is an application process, and you may select that choice as well on your survey that you will get in just a few minutes. Please make sure you complete a survey for each child. So on page 52 of your plan, there is a letter to you that says, parents, school will begin virtually on August 6, 2020 for all Macon County students. For planning purposes, please complete the MCBOE Parent Choice Form for reopening for each school-age child in your home who will be enrolled in Macon County schools during the 2021 school year. Again, this link will be sent to you shortly after the end of the press conference. We ask that you discuss it with your pediatrician. Our phrase in Macon County is pediatricians, not politicians. So please go to your medical expert and discuss with him or her your child's specific needs or concerns about health and make an informed decision that will keep everybody safe and out of harm's way as we continue to deal with this raging pandemic. Ladies and gentlemen, I thank you, and I look forward to each of our students logging on with full connectivity across Macon County on August 6, 2020. Have a beautiful day. Thank you. We sent out a survey to our faculty and staff and to our parents, and that survey came back that 75% of our parents wanted to begin virtually, so we used the data, and 80% of our faculty and staff wanted to begin virtually. And at that time, we were trending in a positive direction. So no doubt, I'm sure the percentages would be higher at this time, so we took a pulse of our community. We listened to our advisory team members, which does include a local medical doctor and our lead nurse, and we felt that for our county, starting virtually and scaling up to in-person is the best approach.
What is your message to parents out there who may have to work with their, or know it's obviously child
Well,
care.
my main message to parents is kind of a slang term, I feel. Because I have a 6-year-old who's going to 2nd grade, and I have a 13-year-old who's going to 9th grade. And so both my husband and I work. And grandmother is not in a position to be able to provide child care. So that is something we're going to wrestle with and we're going to have to figure out. But my personal children have medical contraindications where I'm going to have to make the best decisions for them. And so I will be wrestling with that decision, and I know parents all over will be wrestling with that decision. And that's where team making comes in. We may have to do some different types of shifts with teachers. Some may work during the day, some may have to work in the evening so that they can make that work with their spouse or their significant other. But we're here to work through that, and we have 3 weeks of additional time now that we're virtual to work through that and to figure some of those things out.
You talked about connectivity as far as with students, and of course we understand that a lot of Macon County is rural areas. Can you explain some of the challenges that you think may come up as far as connectivity for students out in the rural areas of the county?
Well, definitely they came up in March. So they won't be things that we don't know about. And I grew up in rural Macon County in the South Macon area. And so Highway 29 and County Road 47 on which I live are very high challenging areas. And we have pockets of areas like those. We have pockets in Novasoga, a community called Brownville near Lee County, communities called Warrenville, Worthington, and Creekston near Hurtsboro and the Russell County line. Near Montgomery County line, we have Cecil in those areas, Hardaway. In the Novasoga area as well, we have dead spots or dead zones. And so for us, it became about finding a solution and a resolution. And so, as I said, I'm blessed to have great people with me and around me. And so all of our district leaders and school principals have been putting their heads in the huddle in finding solutions. And so we've been able to find what we think are several viable solutions. They're not perfect, they're not broadband, they're not fiber optic. But in the best of the best, what we can do short term, we think we should be able to give most of our households connectivity, keeping in mind that a few of them may have to put those hotspots in their car or in their vehicle and move and be mobile to find where that connection point is in their community. But having the hotspots does give every household the opportunity to have connectivity, whether it's actually in the house or they have to drive up or down the road, so to speak. We also have the bus systems with the internet coming on them, and we would not be able to afford that normally. But thankfully for the CARES Act funding and the CARES Act funding that's coming down, we applied early on to get approval for our funding so we could go ahead and get our orders in, because there are a lot of large school districts around the country that are going virtual, and if they get in front of us with their orders, they will replenish the supply because of the great demand that's out there.
Can you remind me how many buses it was again that you have equipped?
38 school buses.
And then how will they be like in a strategic area? Is that the plan?
The plan is for the buses to be placed at apartment complexes and for the hotspots to go to actual single-family dwellings like homes, modular homes, trailers, and things like that. But the complex, the entire breadth of the complex can be covered in many cases with just one bus. The reason we're putting them on multiple buses is because the bus system does have a subscription limit. And so when we reach maximum use in a month on one bus, we will just take another bus and deploy it in that complex and rotate them so that we don't go over our subscription coverage.
Do you have any idea how many families would have to do what you mentioned, like maybe leave their house and go somewhere? You have any data, to support?
We have about 30% of our students who have rural addresses. And so up to 30% of them could have some connectivity issues, but we do have some towers that went in this summer. We have a tower that went in Novasoga. We had a tower that went in the Creekston area. So we have those kind of heat maps or footprints to be able to know where they are, but we'll really have to depend on students because we have some houses that you can't get a connection in the east room, but if you go to the west side of the house, you can pick a connection. If you go on the front porch, you may get a connection, but on the back porch, you may not get a connection. So each family will have to stay in communication with us to let us know what those connection zones are.
So would it be possible to create a task force within the community where people maybe volunteer within those 3 weeks in order so that we can have a good idea as to what the connectivity would be for those families?
Well, we will probably need the task force more so to help deploy the devices, but on the questionnaire that is going out shortly, that's one of the questions. Do you need internet connectivity for your home? And so we hope to, by Wednesday, have all of that feedback back. And the reason we didn't send our questionnaire out earlier is because we wanted to have a plan ready, because many parents may not know the definition of remote learning. They may not know the definition of what hybrid learning is or in-person learning. So we needed to do the education piece before we could get the response piece in place.
What is going to happen with special needs children and children in the special education program? How are they going to be?
Where we're evolving into an era of telemedicine, e-therapy, and we're going to be testing the water, so to speak, with those particular services. Now, with the remote learning that we're going into this time around, we will have stronger platforms, and we have a better idea and additional professional learning in how to take learning out to the kids. So students will not merely be signing into a platform for learning. They will be engaging with their teachers through Google Meets, just as we are interchanging and interacting and engaging here. And in many cases, if parents are available, they will be able to join in as well. So we see that we will be able to do a better job. It does not replace in-person learning by any means, which is why we're trying to scale up to that as quickly as possible.
I didn't hear all of their questions, so I may be repeating something. Will there be runners or technicians floating to assist parents who's not up to date on this high-tech equipment and iron out any little problems they have? Number one question. Number two question is there a generic instruction to parents to help them understand that these cell phones that they are running around with every day can be used as learning devices for their children, because you can learn how to spell anything you want to spell, you can get the answer to any history question you need, and etc.
Well, on the first one, because we're in a COVID situation, we will not have physical ground runners to go into homes to help with connectivity issues. But we will have a help desk that will operate during remote learning, hybrid learning, in-person learning, and at all color levels of alert. And so parents will be able to call into that help desk. But I'm very proud to say that we have technicians right in the home, and they're our students. I call on them all the time. Help me post this. Help me connect to this. Help me log in. So our students are very knowledgeable in terms of technology. Many of them have been born in an era where they don't know anything else. So parents have a first-line technician in the home, and it's the student. And we will be training students more. I was so proud to see some of our elementary students on Zoom yesterday. And I was amazed how they were using the chat box. And it took me 3 or 4 days to figure out how to use the chat box. They were posting thumbs up to their classmates and really engaging. And so I think that is going to be a plus for us. But we will have a help desk that is available for all of our parents to utilize. The other thing is that our students got practice in utilizing some of what we will be utilizing in the spring, where they have to use it for a full 9 weeks. So for most of them, accessing the actual digital content will not be a new process. The new process that we're bringing to the table is utilizing Google Meets, because this time the actual teacher will have her class open, and at whatever time the class meets, all students will be expected to log in unless they have a medical condition or something that prohibits that. And those logins and those classes will be recorded so that for parents who are flipping the script with the time of day that they're educating during remote learning, it will be available 24/7. As well as if students need to go back to it they can watch it again. So I think we have an awesome opportunity to change somewhat of what I call a draconian learning model, a factory learning model that has been with us forever. So sometimes we have to, as we say, take the lemons and make lemonade. And this is an opportunity to do this if we do it right.
Thank you.
One more question.
Yes.
You said that there was a question mark about whether sports was going to take place. Is there any plan in place for practicing if they do that?
Well, that also led us to be virtual at this moment because we tried workouts this summer and we had to shut down again. And so right now we're still shut down. As you know, the collegiate conference that governs our university here, the SIAC, called it. I believe it was last week or the week before. And so we're not having any collegiate sports in our county. And we still have the green light from our head agency, which is the Alabama High School Athletic Association, to move forward. That concerns me. And again, we have to make decisions based on local data, what's good for us. I know our athletes want to play, I know our coaches want to coach, but ultimately we have to look at where the data are and what we can safely do. If it were just volleyball, I wouldn't be as concerned because they are kind of social distance just by the format of the game. But when we start talking about such an intimate process as football, that gives us grave concerns. And we hadn't been able to get through workouts, let alone trying to have a game. So, as I said, right now we have a green light to go, but I don't know if that light will stay green. I really don't know. I just don't see at the moment how it can. I hope that some processes can get us all back to in-person, but I just personally don't see it at this moment. So our current sports workouts are suspended in Macon County until further notice. Knowing that in order to play a contest, there is a practice requirement of a specific number of days that the students have to be conditioned in practice before they can participate in the contest. But on any given day, if we have a team that is quarantined and that team is on our schedule, how will we play? If we have another county that's red and we're red, how will we travel into that county? So there are just so many questions surrounding that type of thing.
When or if school returns to in-person instruction, how concerned are you with requiring students to keep their masks on? And is that something that the school district will provide to students coming into the building as face coverings?
Yes, I can't tell you, I can't quote you what page it's on, but it is in the parent plan. And so students and teachers will each be provided 3 masks initially, and they are reusable, and those are coming from the Alabama Department of Public Health. And the school district has and will have additional masks on hand. When students get into the building and teachers, it is our thought process that we will have on face coverings. So on the school bus and coming in or being in close proximity, they will have on masks. When they get to their desk and they get ready to start learning and they are 6 to 18 feet apart, they will be able to remove their mask. They will have a Ziploc bag in the corner in their tray that they will put their mask in, and then they will take their face shield. And they will pull their face shield on so that they can interact with the teacher while teaching and learning are going on. We also will be using some plexiglass and some clear draperies to provide barriers. You may have seen these in the post office, to provide barriers between teachers and students, and possibly even some plexiglass desk shields or sneeze guards on the tables and desks. But that is what our planning is at this point.
Ma'am, once you had a plan together, did you have to submit anything to the state, or did they pretty much let you on the follow whatever got?
Well, the State Department worked very hard all summer long developing the roadmap for reopening, and superintendents again put themselves at risk going to a conference, 138 of us, to be able to go through the plan and learn from the plan, which had guidelines in it, but not mandates. But there was a section called essentials of things we needed to attend to, and all plans have to do that. Initially, we did not have to submit our plan to the Alabama Department of Education, but I believe last week, different stakeholders were interacting with each other, and it is now being asked that we submit that plan. But realistically, we're at school opening. We cannot throw our plans out and go back to ground zero unless we're all going to be told that we can start school sometime in late September. We've been working on these plans all summer, weeks and nights, teams on the phone, combing the plans, finding physicians who could advise us on these things. So yes, we can revise the plans, but I certainly don't think we should have to go back to ground zero. Any other questions? All right, well, thank you all so much.
We had one on Facebook Live. Will
Yes.
students have to have a covert test before returning to school?
No, let me answer that question. Students do not have to at this point have a test before returning to school, nor do teachers. Let me tell you why. So if you take a test for COVID this morning at 8 a.m. and you are negative for COVID, provided the test is reliable now, it's a gold standard test and not one of these that you pick up at the local corner market. It's a gold standard test, you're able to find out that you're negative. But after you take the test, you are exposed when you go into a local store and you're now infected. You could actually take another test in 3 days and still test negative because you're not in the incubation window. And so it may be 5 to 7 days before you get a positive test. So unless we're going to test every day, and still, as I said, there's an incubation period where you may not show a positive test. It's like strep. The first day you get it, it may not register. Sometimes they'll send it off to the lab if they really suspect that you have it and wait for the lab results to come back several days later and then put you on an antibiotic. So there's really no foolproof system for determining safety around testing. The main thing with testing is so that you can self-quarantine. You can get yourself the treatment you need, doctors can know what to treat, and you can self-quarantine at home. But it's very similar to AIDS. You can give your significant other a clear AIDS test, but if you then contract it 4 hours later, then you may now be infected. So we have to look at the validity and the reliability of testing, but what testing does tell us and what testing doesn't tell us. Thank you all so very much. We appreciate each of you for risking yourselves to come all the way to George Washington Carver Elementary School.
Thank you, ma'am.
Thank you.